times people come and ask me, what is the difference between IUI and IVF? Well, first off, we as fertility specialists and also all over the internet, you read these abbreviations and it's really hard to know IUI, IVF, are they the same? Are they similar? So let me just go ahead and explain a little bit about them. So IUI stands for intrauterine insemination. And so what is that? Essentially, it is a procedure that is done where sperm is taken and prepared in a special way to kind of separate out and optimize getting the best swimming sperm. And that sperm then is taken and positioned into the uterus at the top of the uterus. Okay? It is essentially giving sperm a head start so that they don't have to swim from the vagina, through the cervix, the opening to the uterus, and then into the uterus. They are now positioned closer in the uterus to find the fallopian tube, and usually it's within the fallopian tube that an egg is present if ovulation has occurred. So IUI still involves allowing and making sure the sperm swim to their final destination within the fallopian tubes and having fertilization occur naturally. So fertilization occurring most naturally. For example, having the sperm make contact with the egg, and it's almost like a lock and key mechanism where it makes contact with the egg and then has to enter the egg, and that process of fertilization starts where you have fusion of DNA from egg and sperm. Sometimes IUI is combined with medications that a woman takes, such as pills or injections, and this can be done if a woman, for example, does not ovulate, or to get a woman to do something called superovulation or ovulate maybe 2 or 3 eggs. During that process, there is some monitoring that's involved on the end, so that involves coming in for an ultrasound and sometimes blood work to see how well eggs are developing, and even so, sometimes we trigger ovulation. And the reason we do that is so when the time comes to do an IUI and put the sperm in the uterus, we want to do it at the perfect time when that egg is going to be released, so we maximize our chances of pregnancy. So that's IUI. It's the closest thing to achieving a natural pregnancy, but it does have its limitations. And so, for example, success rates for IUI across all age groups are going to be lower than another type of treatment or fertility treatment called IVF. So what is IVF? IVF is different. It stands for in vitro fertilization. And the concept behind IVF is to take the eggs out of a woman's body once they've matured, and then in the laboratory combine them with the sperm. So the sperm can be inseminated in a standard insemination fashion where the sperm still have to fertilize their egg just like they would in the body naturally, or we can assist fertilization with something called ICSI, or Intracytoplasmic sperm injection. And this is an amazing technology, particularly if a man has severe male factor or low counts or abnormal morphology, because we can look through a sample of sperm and identify the most normal appearing sperm and take that sperm that looks normal, is swimming well, and inject it directly into the egg to get fertilization. From that point on, the development of the early embryo, starting from one cell, is all visualized in the laboratory. That's the part that we say is called in vitro, meaning in the lab. And we can watch that embryo that is one cell develop from 1 cell to 2 cells to 4 cells, 8 cells, as you can see I'm continuing on, till something that becomes a blastocyst. And we watch this process typically over the course of 5 to 6 days, all in the lab. It really gives us a glimpse of understanding what is taking place once the egg and sperm actually fuse and an embryo is developed. This is something that we don't have the ability to see when people are trying to conceive naturally or with IUI, but we have that ability to see that in the lab now to understand what could be causing infertility. And so sometimes we are able to get a sense that there is actually an egg quality issue because we can actually see the eggs in the lab and they have certain characteristics that are concerning with poor quality. Likewise, we can sometimes see that maybe fertilization takes place, but for whatever reason, after fusion of egg and sperm's DNA, the embryo does not continue to form or develop into a structure that continues to divide that could result in a pregnancy. And so that allows us to really understand what may be taking place and understand why there may have been difficulty getting pregnant. IVF also has an amazing technology that is optional, and that allows genetic testing of an embryo. You can actually biopsy some of the cells that will become the placenta and determine the genetics of that embryo. And so all embryos should contain 46 chromosomes, and 23 of those are acquired from the egg and 23 are acquired from the sperm. And in combination, that should form a future baby with 46 chromosomes. Genetic testing allows us to see which embryos have that normal complement, or if an embryo is missing chromosomes, has extra chromosomes, or has any other abnormality. And so obviously we want to transfer embryos that are genetically normal because, one, they have higher chances of pregnancy, up to 60 to 70% chance. They also have a lower chance of miscarriage because most miscarriages are the result of some sort of chromosomal abnormality. And so it is a very, very useful technology. And then some people elect to know the gender of their embryos prior to transfer. And this is sometimes considered gender selection or sex selection, where we can know the embryo's gender, 46XX or 46XY, male or female, and be able to choose and select which embryo will be transferred. And so these are different types of technologies available. They're optional, but that is in a nutshell the difference between IUI and IVF.